Michelle from Ohio wants to talk to us. How are you doing today, Michelle?
Hi, Michelle.
Hi. I'm fine. How are you both doing today?
Pretty
Doing
good.
fantastic. How can we help?
Good. Good. I've been a fan of the show for quite some time. This is my first time calling in, so I'm glad to have the opportunity. I would like to talk to you both about. It was actually a meme that I saw online. It was a meme, but it was, you know, something people were taking very seriously. It said, God will cover children's immune systems, when it comes to the coronavirus. And specifically, I kind of want to drill down about about COVID within the Black community, given the fact that it's has, affected folks in the Black community, more than the general population in the U.S. And just, kind of along those lines is like, a lot of people really think that, quote unquote, God is going to cover their kids' immune systems. But now we're seeing, even with the Delta variant, that it's going after children even more too. And, specifically with Mandisa, I know this is something that, more or less has been kind of talked about before, but it's just kind of disheartening that a lot of times that high religiousness, in the Black community is kind of, negatively affecting people, instead of doing, there's not that many memes that say, hey, go out and do what you have to do. You know what I mean? Like, talk to a doctor. If you have questions about any type of treatments or preventative things, talk to a doctor about that. There's no memes saying stuff like that. It's just like God will cover their immune systems. Meanwhile, children and people in general are dying, especially Black people. So I just wanted to talk to you guys about that.
Absolutely. Go ahead.
Yes. So I will say that if this is supposed to be God's love, then y'all can keep it. I mean, this has to be an awful. This is an awful show of godly love.
It's true.
Especially to the Black community, considering, yes, that we are adversely impacted by the COVID-19 pandemic. Now, of course, we still have to look at things historically, particularly, the lack of access to better health care in Black communities, which
absolutely
is a result of institutional racism and injustice, which is a product of white supremacy, of which Christianity is at the roots. Let's get that out the way right now.
Absolutely.
And it's interesting. Yeah, it's interesting to see the number of churches who have had to adapt to the pandemic and start hosting their services online. Of course, you've had some just disregarding the safety and social distancing guidelines. But unfortunately, because many of us Black folks also have a number of underlying existing conditions that makes us more susceptible to dying from COVID than other, than other folks. This tends to be a problem for us. Now, I will tell you that where I live, I've seen more Black folks wearing their masks than white folks. I'll just get that out the way now.
Me too. I'll admit that.
Yeah,
Me too.
yeah. There have been. So I want to give us some credit there, because we are taking at least the mask mandates very seriously. However, you are absolutely correct when it comes to that. There are still a number of people still holding on even more strongly to their faith to get them through this pandemic. And I have seen quite a few Black folks, and I've heard them too. It's absolutely disheartening for them to actually take in the misinformation about the vaccine. And I'll admit that I had my doubts at first, but after weighing the options and also considering the health and safety of not just my family, but also the people around me, I got vaccinated. Because we are a community that values or prides ourselves on following the science and the evidence. And there is just too much overwhelming evidence to show that the vaccine works. Now, yes, with the variant, and it just goes to show how viruses can mutate, especially those that are airborne, how they can mutate and actually adapt to where even if you were protecting yourself, it can still be deadly. And these are the things that we have to still continue to keep in mind, that yes,
right.
it does affect, it does affect children. And unfortunately, children under the age of 12 still cannot be vaccinated. So it is in almost every adult's best interest, even if they are strong believers in any form of God, to get that jab. Get the vaccine.
Yeah.
My goodness.
That's right. It was almost like, to me, like all that is just thrown away. It's like, well, God will cover them. And honestly, I have to keep it real too. Even outside of the Black community, I'm sure you guys all seen, it was last year when everything kind of popped off. The one preacher, I forget his name, he's down south. He was like spitting, him and his like guys were in the pulpit spitting, and he was like, Corona 19, and he was like spitting in the air. Y'all know what I'm talking about. And it's just like that whole rationality. It was just, I mean, it was kind of funny to me, but I was like, are you kidding me? He was like, I blow the wind of God. Y'all know what I'm talking about. It was
I know what you're talking about.
It was just horrible.
It sounds like a new, I'm sorry, Dan, I'll get to y'all in a minute. It sounds like the new version of the snake handlers. And that's exactly, that's exactly what these guys are doing. And that is very dangerous.
Yes.
Of course.
Yes, it is very, very dangerous. That's why I think sometimes like the whole part of just being rational when it comes to certain things, in religion, unfortunately, it's just out the window. Like, don't be in the pulpit spitting at people.
Mm-hmm.
You're there with 5 guys and you just literally spitting in the air, like just horrible. I just wanted to talk about that with you guys. I know hopefully there's other people to call in, but I just wanted to talk to you guys about that because it really makes no sense. And I really try not to watch things like that, but it is just one of the things like where it's kind of hard not to. It's just like you're baffled with the things that people are saying, in spite of the fact that we actually know and that we can actually test. You know what I'm saying?
Right. Oh,
absolutely.
Yes.
It's a mess.
I think it's important to point out that there's always been this correlation between people's material possessions and their religiosity. In other words, some of the most materially wealthy countries on earth tend to be less religious. And part of that is education. Part of that is access to infrastructure and resources that other countries may not have. But that's interesting. In the United States, we still see these incredibly high rates of coronavirus. It's also because we're an incredibly religious country, I think. And people who don't have the means necessarily to have that same access to infrastructure, people who don't have insurance, will tend to say, well, I'm just going to put everything into God's hands. Going to have God do things for me because they may not have any other kind of sense of hope otherwise, because they may have to go to a hospital room and have to pay thousands of dollars, that they have to pay out for years and years that they can't do.
That is true. That's true, but that's not always the case with folks. I mean, some people really do have the access.
Yes,
still like that too. And that's even harder for me to fathom.
I agree with you. I agree with you, Michelle. We were one of the first countries to have such widespread access to the vaccines. And the fact that so many Americans decided against it is troublesome, especially when the Delta variant was really getting started in India. I mean, it's a dystopian nightmare that we live in. The fact that people don't have an excuse sometimes, that they just don't want to do it. They just really don't want to do it.
And going back to my point about historically, that, the historic institutional racism and injustice, that unfortunately becomes an excuse for folks who for their mistrust of the vaccine and also the medical system. And I just say that it is important to take those factors into consideration. However, it is going to be we don't need to make ourselves any more vulnerable than we already are. And the fact that testing is often free, the vaccine is free, and there are people questioning that. So it's like, unfortunately, lack of information and willful ignorance will be costly in the long run, because at this point, people don't have to die. They don't have to spend thousands of dollars by going into the hospital. So I say to that point, Michelle, you are absolutely correct that there is a certain level of just of codependence on this faith to get people through. But meanwhile, there are people who are catching COVID. There are people who are dying from COVID. And this is evidenced by the numbers. And so we would think that could be enough for people to inoculate themselves as much as possible, even if you aren't directly affected by it. Preventative maintenance is going to be absolutely important here. And now there is so much access to information. There's so much access to testing and access to the vaccine that there really is no excuse. But we are, again, facing an uphill battle when it comes to a community, particularly that has relied on faith for so long. But now it is up to these faith leaders. It is going to be up to these faith leaders to say, hey, even if you still choose to believe in God, get the vaccine, get tested, protect your families, and protect the communities.
Absolutely.
Yes, absolutely. So thank you. I just wanted to chat with you both about that. And thank you again so much. Like I said,
thank you for calling.
Mandisa, I'm going to be, you're welcome. I'm going to be in class during the conference, but I will be checking your Instagram. I will be checking up and seeing how everything is going.
Awesome. And so it is being, you're welcome
so much.
Thank you.
Yes.
And
thank you so much.
I just want to say to everyone that the conference is being recorded. So the talks will be available on our YouTube channel shortly after. And so that needs your support as well. Even if you can't attend live, you can support the conference, especially for, the video playbacks.
Yes. Something just really quick, I wanted to point out that you made allusion to. I didn't know if you even wanted to go in depth on, but you mentioned that because of historic events, that there was mistrust within the Black community when it comes to the vaccines, and part of it, people are citing like the Tuskegee studies and stuff. Tuskegee, you're right. It's Tuskegee. I said it wrong. But which is people don't realize, yes, there have been medical experiments done without the consent of the Black community, just on them to figure out what works and what doesn't work with medications. And people are I've seen this online. I know you have too. People are making the vaccines in comparison to that. I thought it's good to highlight that, to point out that that mistrust is deep, and it goes back decades. I'm glad that you're also pointing out that hey, we have so much data here on COVID. We have worldwide data that shows that this vaccine is really doing what it needs to do. And it is not my belief that the government is secretly doing experiments on the world with this vaccine, but people will, say all kinds of things.
And I just want to go back to the Tuskegee study for a moment, right? Because the longest time it was labeled as a Tuskegee experiment, which it was a study. It was a 40-year study in Tuskegee, Alabama, for farmers, Black male farmers who had syphilis, and they wanted to study the long-term effects. But the problem with the study was that these farmers who were pretty poor and illiterate did not know what they were consenting to. And once penicillin became available, they were denied access to it. And so there were a number of people who it didn't stop them from going out and spreading syphilis to the families and the community. So it was just a monitoring and taking, again, ultimately advantage of poor, uneducated Black folks in the area. And so eventually the CDC had to step in and end the study. And it was in partnership with the Tuskegee Institute, which is now Tuskegee University. It had good intentions, and somewhat good intentions. They had Black doctors who worked with the with the participants. However, because after a period of time where cures became available and these people were denied it really became an unethical study. So I think it's important for people to really read up on that, to truly understand people weren't purposely injected with syphilis, or they weren't purposely infected with the virus or anything like that. But when it came to the denial of care, when it came to the denial of new information because they wanted to study the long-term effects, that is where that was a huge problem for that study. And I just, again, encourage people, Black, white, whoever, to learn more about that, so that, first of all, so that stuff like that doesn't happen again in the United States or anywhere. And just to know like what the circumstances were and why it's important for people to know what, where that part of it comes from, because that's only part of it. But that is still no excuse, again, to ignore the evidence, to ignore the data, and to ignore the fact that refusals to go to the doctor, refusals to get checkups are ultimately going to cut our lives short. And that's still no excuse for not to take better care of yourself.
Yes, absolutely. Thank you so much for your insight on that. I really actually didn't know about this thing until I think it was last year when I first heard about it. I had no idea. And it was because people kept bringing it up in relation to the current pandemic and stuff. So it's really fascinating to hear about it.